think this is going to be a good time as well. We are here because of a resource shortage. We've been talking about this issue for a while. The fact is that the families need more resources for their children. And they're trying to get them wherever they can. In some states, they've been successful in getting them through mandates. In any real attack, that's what it is. And what this is about is trying to create revenue to provide resources to a group of folks who truly need it. When it comes to the educational discussion, what we mean when we say that this is an educational service is that IDEA requires the school system to provide it, period. When the school system loses their lawsuit, and they do, they pay for the child to go to a private school because they cannot provide it themselves. The Faison School testified in this body that they had 71 students last year, 59 of which were paid for by local school districts. That was not by accident, it was because they were required to, and they lost lawsuits on that matter.
Last year you told me that this was strictly an educational problem, not a medical problem. Do you still believe that?
I didn't say that it was an educational problem. I'm saying that it's an educational service. It's delivered in an educational environment by educational personnel. It is not delivered by medical personnel.
Doug, let me ask you this. You heard the doctor say that it's definitely a medical problem, and this bill deals with ages 2 to 6. So, the purpose, as I understand, under the age thing, aside from, political realities, is that if an intervention is done in an early period, it may make it a whole lot easier for the schools to deal with this when they reach age 6 and now they're in first grade.
Right. We've heard testimony that with some percentage of the kids with autism that applied behavioral analysis can be effective. Doesn't mean all of them. It means a small percentage of them. Recommendations from representatives of autism speech testify to this body that it happens, works about 50% of the time. Now, works means different things to different people. This service is something that you try with folks who have a difficult condition, and that's what it is. My only point to you is that there is an established public policy that the school system has an obligation that they cannot get out of, and that the services are delivered in an educational environment by educational personnel. That's what our point is when we call it an educational service.
Doug, this bill has applicable to only the children that are 2 to 6 years of age. There's an opt-out if the insurance increases by 1%. It's got a delayed effective date. It's got a $35,000 cap. I mean, can it be more restrictive? Is there any sort of bill that you would find acceptable to provide coverage to these children?
Mr. Chairman, I would say to the Senator that, in fact, the caps that are in the bill cannot be sustained under federal law. A senator in the body today has called the Secretary of Health's office and asked specifically, in reference to this bill, whether the caps of age 2 to 6 and $35,000 a year can be sustained under mental health parity law at the federal level, which the guidance came out several weeks ago. The answer from the administration at the federal level to the senator in this body was no, you cannot cap it either way.
But Mr. Chair, in that case, the opt-out language would apply, wouldn't it? I mean, if the increase was more than 1%, you're going to get out. Either you've got the cap or you've got the opt-out.
The opt-out is the same, I would say, Mr. Chairman, to the senator. You cannot artificially restrict a mental health benefit to 1% of premium. That, in fact, is what we just changed with legislation by Senator Howard. Senate Bill 706 was about taking off the limitations on mental health services in Virginia's code. You just passed it. And the reason you passed it was because the federal law says we can no longer have those caps in state statute. It was a recommendation of the Joint Commission on Health Care, and Senator Howe carried it through your body this session.
Well, if you're, we'll just have to wait and see, but there is an opt-out provision in there, Doug.
What I'm suggesting to you is that the opt-out provision cannot be sustained under the federal mental health parity statute. In addition to that, we have talked to you about who gets this benefit under the bill. It is only 15% of the population. It's limited to employers who have more than 50 but are not self-insured. So that means they'll go up to a certain size in which the company becomes self-insured. Once they become self-insured, they're exempt from this mandate. I would also point out to you, when you look at the state plan, the reason that the delay is impacted is because there's a fiscal impact. And the reality is that the population that would be affected by this bill is 10 times larger than the population of the state plan enrollment. So, if you want to figure out generally what ballpark we're in, and I think that's where Senator Deeds was trying to go, we're in the ballpark of 10 times what has been suggested for the state plan fiscal impact under the fiscal impact statement for 2016, which would be the first year after 15 in which it would be covered. Ballpark, you're somewhere between 60 and 100 million.
Mr. Chair.
You could sustain the caps, which we believe, and frankly, the administration in Washington believes, that you cannot.
Mr. Chair.
Senator
We
Dees,
had this
we need to-
JAGARP report from the fall of 2008 that said this was, that there were about 7,500 people this would apply to. It would amount to an increase in premium by about $4.88 a month, and then it would save up to $200,000 or more a year, up to $200,000 in the cost of raising a child, educating a child. And you're saying that it's going to explode cost on us?
Mr. Chairman, I'm suggesting to the senator that in fact we're not far off in terms of the numbers. If you're going to say 1%, 1% is about somewhere between $60 and $100 million. Maybe $60 to $100 million doesn't seem like a lot. It's more than the state can afford right now, and it's more than the employers can afford. Whether it saves or does not save resources depends on the effectiveness of the procedure. They may be effective, they may not be effective. And that's by the very testimony of Autism Speaks. It helps with some kids, with others it doesn't. And remember, progress for a child with autism is measurably different than progress for a normal child. And that, I'm not saying the progress is any less meaningful. It's meaningful, but it's different than other educational areas.
All right, thank you very much. Any other questions of Mr. Gray? I guess not. Okay. Next.